Welcome back to At Your Cervix, the podcast. This is session 5. Sponsored by Siobhan O Donovan from PostureFitting Physiotherapy Service. Siobhan is extremely passionate about all things breast health and bra fitting, and she's on a mission to educate women worldwide about something she believes we should all learn as teenagers, and that is how to correctly size and fit our own bra. I don't know about you, but I'm certainly not confident in how to size and fit my own bra. And in theory, this sounds like something that should be easily rectified. We simply need to get the right information out to the right people and at the right time. One of the ways that Siobhan hopes to tackle this is through her Gals Against Gravity workshops, which she designed and developed in order to educate health and fitness professionals about the implications of poor breast support and how they can advise and guide the women they serve to improve on this. Siobhan's also aware that poor breast support is one of the biggest barriers to teenagers and young women entering and maintaining physical activity and exercise. And as you'll soon find out, this is something we delve into conversation with alongside Dr Nicola Brown in this session. So Emma and I are delighted to raise awareness about this important topic, and we hope that in doing so, we start to improve what women understand about their breasts and bra fitting and the importance of it. We would ask everyone to check out Siobhan's resources and upcoming workshops on our website at www.posturefittingphysio.com.
Oh, morning.
Hi, Emma.
Hello. We haven't done a podcast together since 2020, the end of it. And didn't you think at the end of 2020, that was it? We were home dry. 2021 was going to be the big year where life got back to normal. And lo and behold, here we are in lockdown 3. Is it similar in Northern Ireland? Are you deep in lockdown, or have you got some access to amenities and what have you?
We do have access to amenities, so essential services and essential shops can stay open, but it's pretty much, you're not really supposed to leave your house unless you've an essential need to leave your house. So I obviously have always lived at home, worked at home at the minute, so I feel like I've spent a year at home. It's really, really weird. I quite like it.
You're becoming institutionalized.
I know. I did get a dome though. You've seen my dome.
Yeah, tell me more. What is this? So you haven't really elaborated on what you're doing with this dome. So explain a little bit what it looks like and what's the plan.
So for anyone listening, I got what I would call a garden dome. It looks a little bit like an igloo. It's basically see-through. It's frameless. It's just a nice space that I've put down way into the garden. We have a bit of a foresty area beside a stream. It's quite nice. So I decided, with living and spending more time at home, and I'm not sure what it's like with you, Emma, but certainly Northern Irish weather tends to be, we get one day of sunshine in the year and that's our summer. So I was like, I want to spend more time out in the garden. I want ways of being able to do that if it's a bit windy, rainy, everything. And I also want another workspace. I want somewhere where I can change it up a little bit. So the plan is hopefully I will have electricity and internet down to that eventually, in a very subtle, hidden way, because I still want it to be very at one with nature. So I've tried to be as eco-friendly with creating it. And I have recently developed an interest for gardening because I'm trying to plant stuff so that it's going to be nice and colourful through the season. So who knows, it might not work. I'm probably not a good gardener, so we'll see.
Oh, it sounds amazing, because I actually thought, perhaps this is a bit arrogant of me, but I thought you put it in the garden for me to come and bring the family along to visit and stay.
Well, you see, it's funny you say that, because a lot of people have asked me about that, because they're the same sort of domes that, like, we have really quirky areas in Northern Ireland where you can go and stay in these nice retreats and you basically sleep under the stars. You know, they're beautiful. It's the same sort of thing. So you could put a bed in there, sort it out. And it is, and that's really the reason I got it, but I have to make use of it when you're not there.
Oh, you spoil me. I'm quite interested in the gardening thing, because where I live, we have a tiny garden. That's our 2021 dream, to move and get a bigger garden, really, for the kids. We lived in London before we moved into more of the country, into Oxford, and we didn't have a garden, so we were in a flat. So when we moved, we saw this little postage stamp garden, and I think Oscar was, 2 years old. I'd literally just had Martha. and we were so grateful for a patch of grass. We didn't really care about the size of it. Big error. We should have thought about the garden, because all our kids want to do now, particularly in lockdown, is be in the garden. So I have major envy. And the fact that I think you just said you had a stream in your garden as well. I'm going to manifest my world of having a garden, and I'll have a little dome where maybe you can stay occasionally too.
Yes, I love that. No, we do. We're very lucky, and we have a stream. But the only thing I'll say with that is that obviously, then when the kids are wanting to go down, you always have to be down with them. So I probably would be down with them anyway, if you know what I mean. I'm still at the stage where I go out with them, but it's just that idea of it is like they love getting in their wellies and splashing about, and it's only very shallow, but it's still I always wonder. Like, I remember when we moved in, we probably thought when it comes to having kids, we probably fence that area off, but we never did, because it's just so beautiful. Like, it just kind of flows into it. But I need to take better care of it. Who knew before I became an adult, I never realized that there's so much upkeep in things, like even a garden that's kind of wild and it still needs upkeep. Like, it's just, it's crazy. So I'm still transitioning into adulthood a little bit.
Oh, okay. Looking to the future, so this will be out in end of Feb, this podcast. So what will have happened? The Pelvic Royal Conference will have happened in January.
That's right, looking forward to that.
That'd be really cool. That's the 29th of January, I think. Lots of talks on pelvic health, and so hopefully we get to hear some feedback on that from people. And then what will be coming up, it's so weird doing it in the time that we're doing it, isn't it, this podcast? What will be coming up on the 6th of March is the Therapy Live Pelvic Health Conference.
Oh, yes.
Oh, yeah.
Yes.
So I'm presuming if you're listening to this now, probably tickets have sold out, but if they haven't, then jump onto Eventbrite, because I think the tickets are free, aren't they?
They are, and there's lots of really, really key speakers there. Our very own Elaine Miller is keynote speaking at that, and looking forward to tuning in to see how she can make me laugh while educating me even more. But we're doing an At Your Cervix Live.
We are. It's going to be
excited.
Fascinating. We're talking to a lady called Jessica Pinn. Should I give anything away, or should we just say tune in on the 6th of March?
This is going to be a really, really interesting live, possibly a live with a difference. It's a really hot topic. And Jessica's doing she's a huge activist in the area of pelvic health, and you're going to have to tune in more to find out more. Yeah. And just to clarify, I think the pelvic roar is the 30th of January.
Oh, sorry, I've got.
Oh, I know, it's all the dates are mixing in. But yeah, very, very exciting year. Emma and I have lots of things on the horizon. I also want everyone to stay tuned, because we will soon be announcing a project we're working on that has been long overdue coming, Emma. And let's not forget, by the time people are listening to this, your book will be out. Tell me about your book.
Yeah, so we've spoken a bit about it in the past, but it's out on the 4th of Feb. It's called Why Did No One Tell Me? And it's a book for women predominantly, but also healthcare or fitness professionals who work with women who don't necessarily specialise in the perinatal period. And I hope it's a really supportive book, which is just going to talk you through how to protect your body, how to nurture it during pregnancy, childbirth and postnatally, just to give you an understanding of your body. And of course, there's a pelvic health bias to it. And also to empower you. You know, some of these changes that happen during pregnancy are quite overwhelming. Well, I certainly found them overwhelming. And so I thought I'd put pen to paper and write about the journey. So yeah, if you would love a copy, then it's on pre-order now on Amazon. So hopefully you enjoy it. I'd love some feedback on it. So yeah,
I think it's just overwhelming. Awesome. How many patients do we have come into our clinics who, you know, after finding out certain things about their own pelvic health, say, I wish I knew this before. Why did no one tell me this? Why am I only hearing this now? So this is nearly an answer to that call. So I think it's very much needed. I'm looking forward to reading it front to back and to being able to signpost people to it. So yes, well done. Will you remember me when you're a famous author?
I will. Will you remember me when you're a famous pelvic health guru?
When I'm out in the garden in my dome.
/ gardener. I suppose we should stop chit-chatting and introduce and welcome our very exciting new guest. I'm so excited to talk to Dr. Nicola Brown. This is kind of us branching out from pelvic health, actually, more into women's health. We're going to be talking to her about breast health and exercise. Gráinne and I heard Nicola talk in November. She's a brilliant talker, speaker, and so we're really excited that she's agreed to come onto the show. So yeah, I guess we should get the show on the road, really.
Yeah, looking forward to this.
Awesome. Now back to session 5, where Gráinne and I are going to talk to Dr. Nicola Brown about breast health and exercise, which is a little bit of a deviation to what we usually talk about, which is just predominantly pelvic health. So we're really excited about this talk. Before we welcome her, let me just introduce her because she's amazing. So here I go. Dr. Nicola Brown is an associate professor in female health and teaches on undergraduate and postgraduate degree programmes in the Faculty of Sport, Allied Health and Performance Science at St Mary's University. She's also a member of the research group in breast health at the University of Portsmouth, who have worked with many of the major multinational lingerie and sporting apparel manufacturers. Recent projects Nikki has been involved in include investigation of sports bra use, sports bra preferences, breast pain and bra fit issues in exercising females, and breast education of adolescent girls. These projects aim to increase scientific knowledge of breast health issues and to inform effective strategies for optimising health and performance for female athletes and exercisers. So, Dr. Nicola Brown, thank you so much for giving us your time and talking to myself and Gráinne. Welcome.
Hi, thanks. It was lovely to have the invitation. I'm looking forward to talking about all things boobs.
Well, I'm going to kick it off if that's all right. And I just want to know a bit more about you, really. Tell us about you and your interests.
I guess, well, from a work perspective, I started off in sports science, so that's what I did my undergrad in. And then during my sports science degree, I was initially more interested in the health side of things rather than the sort of elite sports performance. And so I then moved on to doing my PhD, which was focused on sort of obesity and weight management, really. And then as I was based at Portsmouth, where I did my PhD, which is where the research group in breast health is based, I got involved with some of their research related to breast research, looking at sort of body composition aspects of that research, which was, you know, similar to my PhD. And then just got really interested in the area. It really kind of not hit a nerve with me, for want of a better phrase, but experiencing breast pain myself, I could recognise the importance of the research, and was just amazed at the beginning just how little research there was. It was just an issue that's almost women just have to accept, well, you've got breast pain, get on with it, and you know, there's not a lot going on in the area. So it was just an area that I wanted to contribute to, really.
I love that. I think it's so very much needed, and it can be quite a fearful thing for women to experience breast pain. So I think that having more research and understanding out there is so important. Do you notice that in the research you've done, and I suppose any experience of talking to women, do you notice the fear elements surrounding it?
I think, yeah, absolutely. I mean, whenever, you know, if you meet somebody new and people ask what you do, and I'll explain that I sort of work in breast health, and almost immediately people's thought process goes to breast cancer when I say that I work in breast health, and then I sort of explain that I work in sort of a slightly different area, more looking at how, you know, we can improve breast support and reduce breast movement during physical activity. But then, you know, 9 times out of 10, I will then have a question about, oh, well, I've had breast pain for X amount of time. Is this a problem? You know, and it is a very anxiety-inducing condition for many women. So yeah, I think the more we can talk about it, the more we can educate women about their own breasts, about breast pain, about how that might change at different stages, when it might be appropriate to report that and seek sort of further support. Then yeah, it's just one step forward each time.
Yeah. Can you tell us a little bit more about breast health, the importance of it, but also give us a little bit of an idea about the anatomy of breasts, so we can start getting an appreciation for the topic a little bit more?
Yeah, sure. So if we think about the breast itself, so obviously sits on top of the chest wall. It's made up of primarily adipose tissue, so our fatty tissue, and then what we call fibroglandular tissue. So that's more the kind of functional element of the breast. So the breast tissue that contains the milk producing glands and ducts. But I guess from a supports perspective, what's important to recognise is that the breast doesn't actually contain any muscle tissue. So it's quite a common misconception that the breasts contain muscle and that we can do exercises to, make them perkier or to make them, more supported. But the breast itself doesn't contain any muscle tissue. So it sits on top of our pec major muscle, which is sort of behind the breast tissue. So the only supporting elements of the breast itself come from the skin and what we call Cooper's ligaments. So these are almost really thin, like hair-like structures that are interwoven between the breast tissue. And they're the only supporting structures intrinsically within the breast. So if we're not with that limited support, if we're exercising in inappropriate breast support, not providing that extrinsic support from a bra, then we leads to a number of different problems. And not all women experience them, and they may experience them to a different degree. But we know from our research that a lot of women will experience breast pain if they're not exercising an adequate breast support. We hypothesize, we don't have the huge evidence base because of the difficulties of the research area, but we would predict that pain is caused by the strain and the sort of repeated loading of those delicate tissues in the breast. If you imagine as our foot hits the ground, it creates a force within the body, and that breast tissue is then sort of dragged downwards, and we hypothesize that is causing that sort of stretching of those breast tissues, which could be linked to the pain and potentially linked to actually permanent damage of those supporting structures, so over time leading to breast sag. Also linked to that breast movement, if we're not exercising an appropriate support, because of the limited support within the breast itself, we get that excessive breast movement. And it's been reported during walking, the breast can move up to 4 centimeters and anywhere up to 15 centimeters when running. So, and also it moves in all directions. So the breast will move up and down, and that's probably the movement that we traditionally think about when we think about breast movement. But the breast also moves side to side and forwards and backwards. So it's moving in 3 dimensions. And that movement can be quite, for some women, can be very embarrassing. So it will impact whether or not they participate in physical activity. So a bit of a barrier to physical activity. And particularly in a survey of adult women we did, or some colleagues did at Portsmouth, of the sort of barriers to physical activity, we know there's many common barriers like lack of time, access to facilities, lack of money, but the breast as a barrier to activity was the 4th under those commonly reported barriers, was the 4th highest rated barrier, and that's the first time that's ever been reported. And I don't think that is because all of a sudden, when a few years ago when we decided to do that study, that suddenly the breast had started to become a barrier. It's just nobody had ever asked the question, is the breast a barrier? We always give people a list of barriers that we are fairly familiar with, and then we rank them and say which ones are most important, but the breast has never featured. And finally, when we asked about it, it's actually it's affecting 1 in 4 women, saying that they won't participate in it, affects their physical activity behaviour. And sadly, when we look at adolescent girls, so a younger population, we found that nearly half of girls report that they avoid sport because of their breasts. And we know there's a relatively simple solution if we can educate young girls about appropriate breast support, and to just start to normalize conversations about breasts. And we've got them, they will move, it's totally normal, and just try and increase awareness and confidence, really, to hopefully enable girls to sort of exercise, one, in comfort, but also with confidence.
I think it's really highlighting that this issue is still a taboo issue. Like many of the issues Emma and I discuss on this podcast surround issues that are considered taboo, and really it's very evident that breast health falls into that as well.
Yeah, absolutely. I think it's certainly starting to become a bit less taboo, I think. And I sometimes have to check myself a little bit that I forget I talk about this all the time. And for me, it's just totally normal to have a conversation about boobs and nipples and whatever else I'm talking about. And then I'll be in a meeting at work and realise that perhaps one of the men at the table looks a little bit uncomfortable about what I'm talking about. And I'm sure you're very familiar with the topics that you're discussing. But I mean, what I found particularly with the adolescent girls, it's been really encouraging actually to hear some of their conversations, that some of them are really confident to talk about their bodies and their relationship with their bodies and how that relates to their participation. And they'll, certainly there's different ends of the scale, but I think it's not all one-sided. It's not all doom and gloom in terms of we're too scared to talk about things. I think the more we can almost get those role models that are willing to stand up there and talk about their own experiences, I think particularly young girls can relate to that.
Because you've done a lot of work on this, haven't you, around adolescence and improving the education around this subject, because let's face it, we have to be trying to encourage women from a much younger age to exercise because of all the huge mental and physical health benefits that it brings. Let's talk about your project, your treasureyourchest.org. Is that right?
Yeah.
So I have a stepdaughter who's 11, and I haven't shown her it yet because I was really keen to talk to you about it first. But I think this will be something incredible to share with her, but would love to just hear more about the project and your passion and why it's so important that we're educating more young girls about their breast health.
Okay, so Treasure Your Chest is kind of the name we've given to our breast education resources or sort of support system. So probably 5 or 6 years ago now, predominantly our research is focused on adult women, looking at their experiences of breast pain, breast support, looking at how we can improve breast support, and then recognizing that sort of puberty is a key dropout age for physical activity. We wanted to focus on that young population because we felt that with all this us pushing the importance of breast education, that actually if we educate girls at a young age, then they're going to continue with that education rather than trying to educate people at an adult and change behaviours, change everything else. So I thought, right, get them young, get them educated, and then they can move forward with that education. So we thought as a starting point, we need to understand, well, what do they know at the moment? What are their concerns? What breast issues do they have? What are they worried about? So that we could then try and develop something that would actually support their needs. So we surveyed around over 1,000 young girls between sort of 11 to 18, I think. And yeah, I guess the headlines from that didn't make a happy read. As I said, nearly 50% of them avoiding sport because of their breasts. Many of them reporting that, reasons why they didn't want to participate would be because either they thought their breasts were too big for exercise, or because they had breast pain, or that they didn't know about sports bras, they felt embarrassed, they were worried what boys were going to think about them. Only 1 in 10 of the girls that we surveyed said that they always wore a sports bra during activity. And now that's kind of almost that's one of our main solutions to some of these problems. And only 1 in 10 girls are wearing a sports bra during activity. So we thought, okay, well, there's a need for this, and we know what they want. We also did some work with teachers, head teachers, heads of years, etc., serving around 250 of educators to try and work out how would it best fit into the curriculum, or what kind of length of sessions, who should deliver it, should it sit within PE, should it sit within PSHE, just to try and make sure that whatever we developed was actually going to be usable for educators to sort of embed within their teaching practice. Because is also, I guess, why we went down this sort of development of resources that we could share with teachers, is that we regularly get asked, we'll get an email from a head PE teacher saying, I notice in my class that there's young girls running around and their boobs are bouncing, and I don't know how to approach this topic with them. And, it would be great if you could come and deliver a session. And, whilst we'd love to be able to do that, with the best will in the world, we can't get to every school in the country it's just not a scalable model for us to be able to reach as many girls as we want to. So we thought, well, if we can develop some resources that are, supported with lesson plan, activities, etc., that then schools can just register and download those resources, then they're able to fit them in, however they best see fit in their sort of school day. So they're freely downloadable for obviously for non-commercial use for teachers, and we often get lots of parents just downloading it individually for their own sort of reference to be able to have those conversations with their children, and also coaches and other sporting individuals involved in sport and coaching young athletes have used the resources as well. So yeah, freely downloadable for them to use. And we've gone through quite an extensive process in the development of those resources. So first, obviously, developing them, to make sure that they're evidence-based and that they're sort of an appropriate level to engage the young audience. And then we went through some quite rigorous evaluation. So I had there was a PhD student, Atifa Amrani, who did a lot of work on this evaluation of the resources. And just to establish, well, how effective are they? Are they actually improving girls' knowledge? Is it making them more confident? Are they, happier to talk about their breasts? And, happily, that's what we found, that there was a significant improvement in breast knowledge, in changes in their attitudes towards their breasts, that they were more positive after receiving the intervention, felt more confident to talk about them. So we kind of felt we hit our aim. That's what we were set out to do. And it wasn't just sort of short term. We followed those girls up sort of 6 months later, and they were still reporting those positive changes. And then, now it's the case we've sort of set up our website and just trying to get the word out there that these resources are available and get people using them.
Oh, congratulations. That's amazing. See, that's exactly what we need, don't you think, Gráinne, with pelvic health? That sort of treasury of pelvic health. I mean, it's not dissimilar, quite frankly. I think that's crucial, don't you?
Yeah, because we've always even said that with pelvic health and all the issues that we usually cover, incontinence, pelvic organ prolapse, things like that, we need to educate them at school age. And it's just as you said, Nicola, rather than try and change behaviours and kind of in a retrospective way try to then focus on things, we're trying to get them as they're developing and understanding their pelvic health so that they can, I suppose, meet all these changes and understand them and know when to seek help. And one of the things you've said that I really want to touch on is that idea. I think I almost wonder, is it a myth that like small breasts don't need as much support, or that they don't need to be considered as much, or what way would you advise regarding breast size and issues?
Well, we've seen, still significant movement with A-cup breasts. So just because women have small breasts doesn't mean that they don't experience breast movement. But of course, if that movement doesn't bother a woman and they don't experience breast pain, then, that's great for that female. So it's, I always think, of course, I'm an advocate of appropriate breast support, but equally, I reckon women have the choice. And if they don't want to wear a bra or a sports bra, or don't feel they need one, and they don't experience any of those issues that we talk about, then that's absolutely their choice. But for the women that do experience those problems and then change their behavior as a result of it, then we want to educate them about that. But even with breast pain as well associated with movement, yes, we do find that in larger breasted movement, a higher proportion of women report breast pain, and we see larger amounts of movement. It doesn't mean that we don't see anything in our smaller breasted women. It's just a less, a smaller proportion of women that experience it.
That's so good to know.
Because you're finding that adolescents aren't wearing even a sports bra. Are we adult women, are we wearing good sports bras? Are you finding that in your research, or are we equally as poor at doing that?
Again, we see different sort of statistics reported in the literature, and I think some more recent research suggests that actually engagement with sports bra use has improved, which is fantastic. So yes, I would say we are a bit better at that now. It's probably variable amongst countries. So we just did a study where we were comparing sports bra use and preferences between the US, the UK and China. And actually the UK was falling a little bit behind in terms of sports bra use of those three countries. So less engagement with sports bras. But also it's interesting that those different population groups had different preferences or different reasons for wearing sports bras. Generally it was support and comfort, but for others, so particularly in China, kind of, you know, the matching other, you know, their workout clothes was also a factor. And in some countries, you know, colour and price were important and other factors weren't. And so I think the more research we can do surrounding that to, you know, how do we market sports bras appropriately? So if we want to engage women in sports bras, we need to know what they want from them. Yeah. So, you know, we're also, alongside trying to, you know, make sure that the bras that are on the market are effective by testing the kind of how good those products are, it's important that we also understand what women want, rather than, you know, manufacturers just making a product that they think is what women want. We need to actually ask them. So we're again trying to collect data surrounding that to inform that, whether it's a marketing strategy that's informed or the actual product that they develop, that it meets the consumer demand.
Interesting, because I would have traditionally in the past, growing up, probably thought that sports bras were like for people who are really sporty or really, you know, elite performance athletes, like in that. And I think that can be a common misconception where people associate sports bras with very fit, active people and not just even day-to-day activity or the recreational exerciser.
Yeah, absolutely. I guess if you think about, there's been a huge increase in our leisure wear market, and I think one of the issues with sports bras is that anything can call itself a sports bra. If you look at the leisure wear market, and people may think that, well, they've bought a sports bra and they're exercising in a sports bra, but it's probably not necessarily functioning as a sports bra.
So how would you know, how do you get what is a good sports bra? Because there's encapsulation sports bras and there's compression sports bras. I hear I'm totally showing my lack of knowledge here. I have got a good sports bra, just so you know. But how, I hope, but how do you know? Is it the type of sport you do that determines what sort of sports bra you wear? Should you be fitted for one, or do you just sort of hedge your bets and go with the same sort of size that you would wear for your, you know, your everyday type bra? Sorry, 1,000 questions, but so let's
start off with the types of sports bras first of all. So you mentioned the compression and the encapsulation bras. So in terms of sort of how they function, so our compression bras are kind of almost like that, if you think about that crop top style. So often are just made of one piece of sort of strong elastic material that you generally sort of put on over your head, rather than having a clasp to do up at the back. And essentially those kind of bras aim to just compress the tissue against the chest wall. And research suggests that those bras are more suitable for smaller breasted women. So if you've got larger breasts, and when we kind of talk about smaller, larger breasted women in literature, generally sort of an A to C cup is categorized as smaller breasted, D and upwards around larger breasted, but that varies in the sort of research that's cited. But so it suggested that, yeah, perhaps the compression bras more suited to smaller breasted women, and then the encapsulation bras, which are a little bit look more like your traditional everyday bras, where there's a separate cup that houses each breast individually, more suited for D cup women or D and above. There is also combination bras, which kind of use both of those compression and encapsulation elements. So they'll house each breast individually, but also have a compressive sort of supportive layer over the top. But I guess the issue is that not every bra suits every person. And so what could be a really great sports bra for me might not be a great sports bra for you, just because of the shape, the size, the composition of our breasts. Also personal preference comes into that as well, in terms of comfort and design, etc. And I would say probably what's equally, if not more important, is whether that bra fits properly. So it could be a fantastic, really functional, well designed bra, but if it doesn't fit you, it's likely to not be doing its job as effectively as it should. So should always be trying on a sports bra before we buy it. Have a jump around in the fitting room. You can determine how well your breasts are supported by, if you jump up and down in front of the mirror, you can see the movement, you can feel whether they're supported or not. So I'd definitely recommend trying it on before you buy.
Is it fair, Nicola, to say that like women's breast size fluctuates? And if we even think it, like, I know there's not a lot of research in maybe the postnatal field, but certainly if we think of a woman's lifespan and the changes her body goes through, certainly the size of her chest wall and her breasts may fluctuate. So obviously it's, I'm presuming, very important to regularly get rechecked and reassessed and redo those type of jumping around fit tests.
Definitely. And I think traditionally, because we use that the traditional method of bra fitting is to use a tape measure, to measure under the breast and then across the breast tissue, and then subtract a arbitrary number from the other to calculate your cup size. And we know that there are issues surrounding that's measuring system. And we would advocate what we call sort of best fit criteria. So rather than going by a tape measurement, actually look at how the bra, each individual bra fits you. Because we know that, I might be one size in one bra, but in a different brand or a different style of bra, I might be another size. And so in terms of your point of those changes that we go through, a lot of women will get measured and, go in and have a professional bra fit, and they're told they're a 36C. And they think they're a 36C for the rest of their life. And it may be that they go through a range of sizes throughout their lifespan. So as we've got puberty, and we know, I suppose it's fairly obvious that your breast size will be changing then, but we see fluctuations across the menstrual cycle. There'll obviously be other key life stages that some women go through in terms of pregnancy, breastfeeding. And then we've got menopause, where again we might see other changes, even changes in our body weight may influence our breast size as well. So just because we were measured when we were 20 as a 36C doesn't mean when we're 50 that we're a 36C. But I think we get stuck in that kind of mindset quite a lot. So certainly getting regularly fitted, or what I would advocate is that women learn how to fit a bra themselves. So if you know the criteria that you're looking for, almost the size of it is irrelevant. It gives you a starting point to know what hanger to pick up off the rack. But if you can put that bra on and know, well, what should I be looking for in the underband? How should the cups fit? How should the straps be? Then it doesn't matter what bra style, shape, design that you put on, you've got that ownership to decide whether or not it fits you. And the size of it becomes irrelevant. I mean, I've got bras in my drawer that range 3 different cup sizes just because of the different styles. So there's not a one size fits all.
I think I have the other problem. I think that even though the sensible part of me knows that bodies go through changes, and that if I think of even the last decade, I am probably just always by default going by a size that I got measured with one time. And and I know I put on some bras and they don't fit me properly, even though, you talk about that criteria. I know that some bras don't fit me properly. And I think this is something that I'm sure a lot of people listening to this will relate to. And I think it's really highlighting the importance of us taking breast health a little bit more seriously and making sure that we are supporting ourselves. This is so interesting. This is triggering me to want to do a clean out.
Me too. Because I guess you're seeing that with a really good supportive bra, well, if women are experiencing breast pain, is that reducing? Are you seeing, what are the benefits of having a really good supportive bra are you seeing in your research?
So even just in terms of everyday bras, that fit correctly and are supportive, we see reductions in breast pain. So I mean, it's one of the key recommendations if a female goes to their health professional, GP, health practitioner, to with a complaint of breast pain, one of the sort of first line treatments is wearing a well-fitted supportive bra. So, I mean, I would argue then, do health professionals all have sufficient knowledge of what to recommend what a well-fitted supportive bra is, given that women themselves don't know? So I think there's another area that we could perhaps sort of tap into in terms of education. Obviously, there's lots of knowledgeable health professionals. I'm not trying to say that no one knows what they're talking about, but if that is the recommendation, where is the guidance and the advice that they're getting? You know, is it just a leaflet that you're given saying, you know, here's what to look for? We know that women that might experience sort of back and neck pain as a result of the size of their breasts, that by changing their support into a more effective support, it can alleviate some of those concerns. Obviously, reducing embarrassment levels, increasing confidence with participation, changes in posture. So yeah, we see even if we look at the kind of sports performance aspect as well. So we've got the health aspects, but also, you know, how might that change how we perform? There's research that suggests we actually change our movement patterns depending on the level of support that we're wearing. So in less support, we might take shorter strides to try and almost counteract that movement, I suppose, support our breasts naturally, which could have an impact on performance over time. If we're thinking about distance travelled and how quickly you're trying to travel that distance. Changes in muscle activity, so some of our muscles working harder when we're not wearing appropriate breast support, so that could have fatigue issues over time. So it affects a whole host of different things, both kind of sort of physiological, physical and psychological, really.
Wow.
Talking about breasts in terms of breast pain, I know a lot of people listening to this will be wondering, like, when do you not need to worry, but when do you really need to make sure you get breast pain checked out? Like, there's bound to be kind of guidance around that.
Yeah. So breast pain is something that women, you know, a huge proportion of the population experience breast pain, and it obviously that can cause women a lot of anxiety. So, but generally on its own, breast pain is rarely a symptom of breast cancer, or it will be prevalent with other symptoms, particularly with sort of inflammatory breast cancer, which has other symptoms associated with it. Breast pain might sort of feature within that. So I guess what's really important is that women know what's normal for them. So getting used to kind of knowing what their breasts look like, how they feel, you know, how the sort of patterns of pain and how that changes over the course of, you know, perhaps a menstrual cycle. And I guess what would be important is that when you notice anything that's not normal for you, like if you know you'll always get a little bit of breast tenderness before your period, you know, then that's probably pain that you don't need to worry about. It's something that regularly happens and then it kind of goes away and then you'll experience it the next month. But if you start to get pain that you don't normally experience, or it changes, or it's more significant, then of course any change in your breast that is not normal for you, then always seek support, get some advice from a health professional. And obviously there's many signs of, if we're thinking about breast cancer and being breast aware, there's breast pain is not the only symptom, nor is a breast lump. And those are the two things I think that women focus on most commonly, about, you know, I've got a lump or I've got pain, and those are the things that women are concerned about. But there's a number of different things that we need to be aware of, signs and symptoms. And again, not just because you experience one doesn't mean that you have breast cancer, but it means that if it's unusual for you, if it's a change that, you know, hasn't happened before, then get it checked out, because the sooner you get it checked out, either, you know, best case scenario, you find out it's fine and you stop worrying about it. If it does turn out to be something, you've got there early to get the support as early as possible to ensure that it's not as severe as it could be. So get in there early.
Yeah, I couldn't agree with that more. I had a bit of a scare back in the summer. I found a lump under my armpit and I'd been getting quite a lot of breast pain. And I probably I've always been good at checking, but probably not as regularly as I should. So now I check every month, and all was well. Fortunately, I did go straight to my doctor, and they were amazing. They sent me for a mammogram and an ultrasound. I couldn't sing their praises highly enough. And it all coincided with my mum having a diagnosis of breast cancer as well. So perhaps that's why I became more aware of things. I don't know, but fundamentally all was well. But I do love charities like Copperfield, and they have their little shower sticker that you put on your shower tiles, and it just talks you through how to check your armpit and your breast, little diagrams. And I think charities like that are doing an incredible job of raising the profile of the importance of regular checking. And it's just so important that we're doing it as women, isn't it, from a young age?
Absolutely. I mean, from that survey that we did with the adolescent girls, breast cancer was actually their number one concern. Like 70% of girls said that is something that they are concerned about. So that's what we built that also. Whilst traditionally we've come from a sort of sports bra activity, breast support background, that's what girls are concerned about. So again, get them at that young age when they're going to develop those positive breast habits of checking their breasts. We've embedded that into our education program as well, so that just helping them to be breast aware. And traditionally, breast awareness, or it was known as breast self-examination, it was quite structured. You had to do it at a certain time frame and do it in a certain way. But really, it's doing it in however it works for you. If you do it in the shower, if you do it when you wake up first thing in the morning, do it in front of the mirror so you can actually see changes as well as feel them. Doing it at different times of the month so that you actually get to learn how, your breast might get a bit lumpier depending on what stage of your menstrual cycle you're at. But just knowing how your breast changes, then it sort of helps alleviate. If you do it at the same time every month, and then a year later you do it at a different time, you suddenly think there's this awkward change and that you get really worried about. But if we start to sort of be more aware of what our breasts look and feel like at different stages of our cycle, you just got to get to know them really, so that you know your body, and then it helps you know when something could be wrong, that you can get checked out. And then just as you did exactly the right thing, get in the sort of health pathway to get checked out, and fortunately a great result, so really pleased.
Yeah, me too. But yeah, no, I think that's brilliant messaging, thank you. Something else we wanted to touch upon, which is a bit mean because I'm not sure what level of evidence is out there really, is Gráinne and I are really passionate about the perinatal period, wearing bras during pregnancy and postnatally. And obviously we see a lot of women, particularly postnatally, who complain of breast pain. What sort of research is there around breasts in that perinatal period? Because what I struggle with is knowing what to advise women on with their breast health around this particular time of their life. So sorry if I'm sort of asking you a question where there maybe aren't many answers, but would love to just know your opinion on it really.
Yeah, I mean, it's definitely a kind of a population group that we'd really like to do more work with, because it is a group that's been so far not ignored, but it hasn't been given the attention that it needs. There are certainly more pregnancy and postnatal sports bras on the market than there were years ago. And so some of them might have like specific nursing straps to, that for that transition between exercise and nursing, or sports bras that have removable cups that you can actually replace with nursing pads if that's an issue that you want to try and solve. But in terms of sort of the recommendations, I've heard many things about women saying that whilst they've been breastfeeding, they've just doubled up, wear two bras instead of their normal sports bra, because that's all they feel that they can do. And there's that balance between obviously needing to provide the level of support, but the increased tenderness of the breast, that then increasing the pain level. So again, I would say fit is probably the most important, is one of a really important consideration, particularly with such variable changes in breast size during pregnancy and during breastfeeding. that breast size is going to be fluctuating quite considerably. So probably having a range of sports bras in differing sizes to account for, when the breasts are fuller, pre, post feed, etc. But yeah, it's certainly an area that we need to tap into more to be able to perhaps aid manufacturers in developing bras that have got the right kind of components and configurations that will help pregnant and postnatal women, but also things that educating that population group of what they should be looking for.
Brilliant.
And I think there's the added complication in this population, particularly for the breastfeeding mothers, because sometimes breast pain or a lump can be a sign of mastitis or a blocked milk duct. And so that's something that we would see a lot of in physiotherapy as well, for helping, I suppose, alleviate some of those milk duct issues. But it's just knowing, as you say, knowing your breasts and knowing what's normal for you, so that you can make sensible decisions as to when you need to do something, or when you need to think, oh well, that's just tenderness, that's a normal part of my cycle. So it's just it's fascinating hearing you speak about all this, because it's just, oh my goodness, it's opening up so many more questions for me, but in a good way.
I mean, it's the same with us. Every time I certainly find that every time I do another study or work with a different population or a slightly different area, I come up with another 12 questions that need answering. It's never ending, but we're plugging away one step at a time, trying to learn more.
Yeah, it's fascinating. What are your future plans then? So are there any plans for your research to go into the perinatal population, or what have you got planned for 2021 at the moment?
Well, a lot of my plans this year have gone slightly wayward, what with the global pandemic. But yes, so future plans. I'm particularly passionate about the education aspect, so from my sort of personal research interests. So still focusing on that adolescent population, looking at other sort of strategies or ways that we can develop that education initiative, whether that is looking at, even having sort of those peer support systems. So could we use girls in older years to educate the younger girls so that they've, again, more relatable, looking at that, whether that's an effective sort of mechanism, but also taking that education aspect into other populations. So using a similar model. So, what do that particular group want to know about? How can we develop something to educate that group? And then can we evaluate it to make sure it's effective? So, the perinatal, pregnant breastfeeding women, that could be a population that we look at. First of all, understand what are the issues that they're experiencing during those stages. What problems do they have? What are their concerns? What can we then do to try and solve those problems, and then develop that strategy that we can try and sort of promote. So there we go. There's a new idea for 2021.
That'd be fantastic.
And I'd like to do something that education could apply to many different areas. So I'd also be interested in women, that sort of post-surgery from breast cancer, that have, perhaps have had a mastectomy, may have had breast reconstruction, and are, now dealing with a whole new set of, learning about the new breasts that they've got, and different support requirements. So looking at, at that particular population, of how we could support them in terms of their journey after experiencing breast cancer, looking at health professionals in terms of their knowledge levels. So we could go on and on. I'm obviously not going to get all of this one, so I perhaps need to look at my to-do list and be a bit more realistic with my goals. But yeah, those are sort of some of the key things that I'd like to work on.
I was going to say, I'm not going to go down a rabbit hole, but I think it's fascinating listening to you talk, because then you're starting to think about populations, like maybe what about women who have had breast implant surgery and how that maybe impacts the breast, or what about even transgender populations and maybe people who are maybe taping down breasts to conceal them, or people who are getting breasts. So it's just, I'm sure there's a lot of research questions that could be explored.
Yeah, it is endless. And we've done a bit of research on sort of looking at women that were like pre and post implants, to see what sort of changes have happened in terms of the movement of their breasts, but also how it changes their movement patterns. But I think with some of those research, or some of that research in those populations is very much in its infancy. You know, may have just done one sort of preliminary study, and we need to certainly build the evidence base to truly understand what's happening for those specific groups, and to make any kind of clear recommendations, I suppose, for them.
Oh my goodness, I want to ask you 1,000 other questions, but I'm so conscious of time. We'll absolutely put your the links in our show notes for treasureyourchest.org. I can't remember if you said this, Nicola, so I'm just going to ask you again. Is there a resource for healthcare professionals or even women that you would recommend on how we best measure ourselves for our bras?
Within the resources themselves, the Treasure Your Chest resources, or we've targeted them at 11 to 14-year-old girls, but there is a bra fitting video that features in that, which runs through the key features that you should be looking for. So, and I think, well, if a 11 to 14-year-old girl can understand it, it should be translatable to our adult population and our health professionals. So, there's a place to look. And I'm sure I've probably got another link to where we've sort of listed our criteria that you could look for. So I'll look that out, and you might be able to add that to your to the information as well.
Oh, thank
Fantastic.
you. That would be great. A million thanks. It's just been so informative. I think we should get Nicola on again to talk more about her research for 2021.
Yeah, I'll give you an update on all of those other population groups that I've now know all about, that I've done in 10 months. Brilliant. No pressure.
Oh, Nicola, thank you so much. It's been brilliant talking to you.
Great to talk to
Thank you.
Thanks for tuning in, everybody. Don't forget to subscribe to our channel and to leave a review. Our next big event is Therapy Live Pelvic Health on the 6th of March, where Emma and I will be at your cervix on a live show speaking to Jessica Pinn about all things clitorally speaking. We'll follow this up with a full session release on the 21st of March as well. Thanks once again to our session sponsor, Siobhan O Donovan from PostureFitting Physiotherapy. You can find out all Siobhan's links and details in the show notes below, and we look forward to being at your cervix again soon.